Hi, my name is Marie Milross and I'm a co-author on this publication comparing non-invasive ventilation to low-flow oxygen therapy in cystic fibrosis. We designed this study to determine if patients with CF and sleep desaturation were less likely to develop daytime hypercapnic respiratory failure if treated with NIV than with oxygen therapy alone. Uncontrolled, non-randomized studies suggest a survival benefit with NIV in CF, in addition to it being identified as an effective bridge to transplantation. And the studies have demonstrated NIV to be superior to oxygen therapy in improving sleep hypoventilation. Yet short-term NIV during sleep has not been shown to reduce daytime CO2 in hypercapnic CF patients. No RCTs have been published that examine the long-term effects of NIV in CF. The primary aim of this study was to determine if patients with CF and sleep desaturation were less likely to develop hypercapnia and fail therapy and remain event-free over a 12-month period. Secondary aims were to examine effects on hospitalizations, lung function, arterial blood gases, sleep quality and health-related quality of life. This study was a prospective, randomized, parallel group study in adults with CF and sleep desaturation. Patients were recruited from two large Australian CF clinics. Eligible, consenting patients were randomised to receive either 12 months of NIV or oxygen therapy during sleep. NIV and oxygen therapy prescription was individualised and optimised during sleep studies. Outcomes were measured at baseline and then at 3, 6 and 12 months. Event-free survival was measured as the number of people without events cumulatively over the 12 months. Any of the following were considered as an event: failure of therapy with increases in CO2 levels, lung transplantation or death. Hospitalisation episodes were recorded for all participants from 0 to 3 months, from 3 to 6 months and from 6 to 12 months. Our aim was to recruit 40 patients to this study. Recruitment to this study occurred over 12 years. 29 adult patients aged 18 to 50 years participated. Data collection was formally ceased due to recruitment challenges without achieving the target sample size of 40. In the 29 patients studied, 33% more participants in the NIV group remained event-free at 3 months and 46% more at 12 months than in the oxygen therapy group. No significant differences were seen in arterial blood gases, hospitalizations or questionnaire data. In this study, we have shown that NIV during sleep significantly increases event-free survival over 12 months in adults with CF. Although not accompanied by other statistically significant differences, this study showing event-free survival benefit adds to the body of evidence supporting the safety, feasibility and effectiveness of the use of non-invasive ventilation in CF lung disease.